Hello, everyone. Good afternoon for some of you, and welcome to this second session of Duan Solutions for Lymphedema, Mobiderm. Today's webinar is going to be about evidences and the different solutions in maintenance phase that will be presented by Mathilde Ayou et Slavomir Pechniak. So Mathilde and Slavomir, I'll let you introduce yourself for those who haven't been here yesterday. And just for your information, the microphones are muted. So if you have any informations, please send them on the chat box. Have a good presentation, everyone.
Good afternoon, everyone. My name is Mathilde Ayou. I'm the International Product Manager for Lymphedema Solution at TUAL. So I'm responsible for all the lymphology solution we are developing for the different countries. And I'm going to present you this webinar together with Slavomir. So I'll let you introduce.
Yeah, hello everyone. My name is Slavomir Pechniak, and in Juan Group, I am scientific affairs and educational specialist, and also I'm responsible for T1 Compression Therapy Center, the specialized clinic for diagnosis and treatment of odemas different kinds. So my role for today would be to present some evidences about clinical trials related to Mobiderm.
So let's get started. The agenda for today will be to present you the Mobiderm solution in maintenance phase. Then Slavomir going to present you all the clinical evidences that we have available today on the Mobiderm. Then we're going to cover the patient self-management and how that's applicable to the lockdown. And we will end with question and answers. So starting with the Mobiderm solution in maintenance phase. So during the first session, we presented you how the Mobiderm technology is working, the mode of action, and all the solution we have for the reduction phase. What is interesting with the Mobiderm range of products is that we also have solution adapted to the maintenance phase of the treatment. So first of all, why choosing a rest and night treatment with Mobiderm? First, because it's recognized by the International Society that it's important to continue the treatment during the night, to have a 20 hours treatment, so with a knitted solution for the day and with mobilizing solution for the night or self-bandages. So with the Mobiderm, it will provide a smooth pressure during the night. So you will have an efficient mode of action, efficient treatment, while having a smooth pressure. So it will be very well tolerated by the patient during the night. It will promote the lymphatic circulation with a micro massage due to the foam cubes inside the Mobiderm. And it will optimize the long-term results of the reduction phase. So Slavomir going to present you the result we have from a clinical study using Mobiderm right after the intensive phase of treatment will really allow to postpone the next intensive phase for the patients. And as it's a very easy to use solution, it will enhance patient autonomy as well. So we have a full range of solution in as garments for the reduction phase, for the maintenance phase at night, to adapt most patient needs. So first of all, we have the adjustable version with the Mobiderm Auto Fit. Then we have a standard version with some other models. And we have the made-to-measure version as well. So starting with the Mobiderm AutoFit. So the Mobiderm AutoFit is available in 3 different models. So you have the arm sleeve with the mitten attached. You have the below knee and the thigh high. So you can cover upper and lower limb lymphedema. We have a large range of sizes with this product. So the product is adjustable, and each size covers a variety of measures, of circumferences for the different point of measures. So first of all, you have a very few point of measures to be taken. So it's pretty easy to measure and to order for a fitter. And you cover a pretty large range of circumferences for various patients. So you can see that for the G point, for example, at the axillary, you can cover from 25 to 52 centimeter circumference. So you can really adapt to many patients and many limb circumferences. And so you have 6 sizes for right hand side and for left hand side, and then you have normal or long lengths. Same for the lower limb models. For the below knee and thigh high, you have a pretty large range of sizes as well. So 4 different sizes in circumferences, and then you have 4 different lengths: short, normal, long, and extra long, to really adapt to each patient. So first of all, the Mobiderm AutoFit is made with tightening notches. So you have pluses on the fabric of the garment to know exactly where to adjust the garment to adapt the limb circumference of the patient. So one garment, one size of garment can cover multiple circumferences, and with the pluses you can tailor the adjustment to the patient. And it will allow a precise and repeatable application, so the patient can easily repeat the application. He knows exactly where to adjust the garment for his or her specific limb sizes. And it also allows a kind of self-management by the patient, because if he used to adjust the garment, the Velcros at I don't know, 1+, and after a few weeks he has, 1+ is too tight, he has to go to 2+. That means the limbs has recovered some volume. So it's a way to self-check and self-manage the lymphedema for the patient. You have Velcro fasteners to help adjusting the garments, so it's very easy to set up, and high performance Velcros for good durability. So on the lower limb garment, you have 2 rows of double row of Velcro, so that allow to have the same garment for left and right sides. And on the upper limb, you will see you have only 1 row. Below the foot, you have anti-slip sole, so to limit slippage when walking. If the patient woke up during the night, it will avoid the slippage, or if you use the garment during resting time at home. The garment is also semi-open. All the AutoFit garments are semi-open to facilitate donning and doffing. The lower limb models are ambidextrous, so it's the same garment for right and left side. So that's not interesting for the patient, because usually he has, even if he has two legs affected, he may have different sizes of garments. But that's interesting for the fitters to have only 1 reference in stock and be able to cover both sides, so you can have enough stock for a quick delivery of the product to the patient. And we have multiple sizes to adapt various patient morphologies. So if we look at the upper limb model, so it's the same principle. We have tightening notches to to adjust the size of the garment to the limb, the Velcro fasteners, and you have the mitten attached. So why do we have the mitten attached and we have no model without mitten? So we decided to have the mitten with the arm sleeve to limit the risk of migration of the edema to the hands during the night or the resting time. If the patient needs to free the hands to do things at home during resting time, he can pull back the mitten to free the hands. And it's semi-open with multiple sizes. So the Mobiderm Motofit garment with the Velcro adjustment, that's something that is patented in many countries. So delivered with the Mobiderm Motofit garment, you have this sheet as part of the IFU. So what is important with the Velcro adjustment on Mobiderm, and that's what is often a confusion, is that the Velcro are not there to adjust in pressure. They are there to adjust in sizes. So if, for example, you take a size 1 of lower limb, the size 1, for example, at B point, you can, it's adapted for circumferences at B point from 16 to 24 centimeter. If the patient has a circumference at B point of 20, then he needs to adjust at 2 places. So that's the role of the fitter to explain to the patient based on his or her specific circumferences at how many places to adjust the garment at the different point of measure. So we have some videos available to show the how to don the garments. So you have one available for the upper limb and another one on the lower limb. So they are available on our YouTube channel. So that's interesting video for the patient or for the fitters to see how to set up the garments. So usually what is recommended is to open all the Velcros. In case of lower limb, we recommend to open only one row of Velcro and keep the other row closed at the right level of size, at the right level of places. Then you're gonna close all the Velcros one by one where you can, where the patient can, because for the upper limb model, that's more difficult having only one hand free. And then you tighten step by step to achieve the proper setting. So in this case, it's 1+ for this patient. So she has to reach the 1+, and then she needs to try to align the Velcros all along the garment. So that needs to be done in a different step to have the proper adjustment. Then we recommend to massage the garment to have a good repartition of the foam tubes. And it's the same way to proceed for the lower limb. So the benefits of choosing a Mobiderm Motofit garment is first that it's pretty easy. So it's quick to deliver to the patient because it's a standard product. We have it in stock in Tuan, and the fitters can have a stock locally. It's a very simplified measuring process, only a few points of measures to be taken on the patient. We have a wide range of sizes, so it covers a wide range of sizes to adapt different patients. You have a bilateral lower limb models to optimize the number of references in stock for the fitters, and it's just one piece. Some other mobilizing garments, you have one piece for the leg, one piece for the foot, same for the upper limb. So this one is really in one piece. And you get all the efficiency of the Mobiderm technology. So then we have the Mobiderm standard. So the Mobiderm standard is made of 3 models, but only for upper limb. You have the arm sleeve, so it's a simple arm sleeve. You have mitten and glove. You also have a pretty large range of sizes, so from 1 to 5+ in size, and long and normal lengths for the arm sleeve, with just 3 simple point of measures to be taken. And same for the glove and mitten, 6 sizes. For the glove, you have a right and a left side. And for the mitten, it's only one reference because you can pull back the mitten to make right or left side with only 2 points of measure, A measure and C measure. So what is interesting with the Mobiderm standard is that, again, you have a quick delivery to the patient if he needs to have a garment very quickly, and if the patient is in the standard sizes, you can get it very, very quickly. Simplify measuring process as well, only few measures to be taken. We have a wide range of sizes. It's more narrow range of sizes than the AutoFit, but it's still pretty large. The mitten is reversible to accommodate left and right hands, and it's a one-piece product with all the efficiency of the Mobiderm technology. So this product can be interesting if the patient, for example, doesn't want to have the mitten attached. Then you can recommend this product instead of the Mobiderm AutoFit arm sleeve. So he has the arm sleeve, and he can remove the mitten or the glove. And if the patient is not is out of the standard measures due to the size of the lymphedema, then the option is to go for made-to-measure Mobiderm. In made-to-measure, we have almost all the models. We have the arm sleeve with mitten, below knee and thigh high. You have some options, like you can choose to have the sock in big blocks or in small blocks, or have a mix, small blocks on the feet, big blocks on the leg. You can have the mitten with and without thumb. You can have Velcro opening to facilitate donning and doffing. So there is some customization available on those products. And you have anti-slip as well. So this product will be really adapted to all type of patient, because we will make it based on the measures, so with a perfect fit to the patient, and you have different options for very specific needs. And you're gonna have all the efficiency also of the Mobiderm technology. So in general, all the garments, the AutoFit and the standard Mobiderm, you're gonna have small blocks on the end or on the foot, and big blocks on the arm or the leg. You have no foam tubes below the foot or inside the ends. It's only on the dorsal side. And so that's all the standard garments and AutoFit are made like this. If you have some specific need for the patient, then the option will be to go for made to measure. So all our Mobiderm garments are made on the outer layer of polyester, polyamide, and elastan. The inner layer for the big blocks is made of adhesive nonwoven polyurethane foam and medical glue. And the inner layer for the foot and the hands, so it's made of small blocks, so polyethylene foam with adhesive nonwoven. So it's important to know the composition of the product in case of allergy by the patient to one of the components. But you know, polyamide elastan is very commonly used in compression garments. So where the patient can have skin reaction and allergy would be more on the composition of the foam. So the fitting instruction for made to measure and standard, so it's pretty similar to other compressive garments. We recommend to slip on the Mobiderm arm sleeve and then to insert the arm and position the garment up to either the armpit or the knee or whatever, depending on the model. And in case of usage of a mitten or glove together with an arm sleeve, for the standard version, for example, we recommend to have the mitten or glove position superimposed on the arm sleeve, the extremity of the arm sleeve. So for the auto fit, I show you the video, pretty simple to don. Just that it's important to adjust the velcros step by step. So the Mobiderm is really a very good alternative to self bandages. So the recommendation most of the time in most of the countries is to ask the patient to make self bandages during the night to have 24 hours compression. But you know, it's very complicated for patients to make self bandage. It can be too loose, not being efficient, or too tight, and that's not good for the limb circulation as well. So it's very difficult to find the right pressure, the right compression during a self bandage. So having using Mobiderm is really a very good alternative to self bandage for the patients. It will promote their autonomy. So first, you're going to have an efficient nighttime treatment. So it will help preserving the effects achieved by the daytime compression. So the daytime compression will maintain the volume. And with the Mobiderm during the night, you will keep maintaining the volume during the night. Even in some cases, you're going to reduce a little bit the volume of the duodenum. Slavomir will present it to you through one of our clinical study. We demonstrated that also the usage of Mobiderm garments during the night limits the rebound effect that the patient can have after the reduction phase. It's very easy and rapid to don and don the garment. So it's a single garment to put on, and it will promote patient self-management. Due to the low compression, the low pressure provided by the garment, which is about 15 millimeter mercury, it will really not disturb the sleep. So it will work during the sleep without disturbing the patient, which is always one of the issues with the compression garments. At night, the patient, they are not compliant with nighttime treatment because it's disturbing their sleep, and yeah, they cannot use it. So the Mobiderm has been demonstrated as very comfortable and very well accepted by the patient during the night. And you have a complete range of products for reduction phase and maintenance phase to really adapt all the patient morphology and to be there with the patient all during the treatment. So as part of one of the study we did, the Marilyn study, we have asked some satisfaction results to the patients. So it's based on 40 patient feedback, and 82% of the patients were already wearing compression prefer the Mobiderm AutoFit to the garment they used to use for the night. So the comfort was very well rated, the ease of application, quick fitting, useful self-adjustments. So all the different benefits of the Mobiderm AutoFit was very well accepted and rated by the patients. So how to position the different products, how to select the right Mobiderm garment for the right patient. So what we recommend is to use the Mobiderm standard for mild lymphedema, stage 0 or 1 for the upper limb. Then you can use the Mobiderm AutoFit for moderate lymphedema, upper limb, and for lower limb lymphedema, moderate or mild, because you have the lower limb model in the AutoFit range. And again, Mobiderm standard is a good option when the patient doesn't want to cover the ends for the upper limb, if you want just a simple arm sleeve, or if you want to have a detachable mitten or glove for the resting time. So that can be an advantage of the Mobiderm standard compared to the AutoFit. But the AutoFit is adjustable, so it will better follow the volume evolution of the lymphedema. And for severe stages, like the stage 3, you often have large volume that may not fit into standard sizes. You may have irregular limb shape. So in this case, for both upper and lower limb lymphedema, we recommend the Mobiderm made to measure. So I propose you to make a short quiz to check if the information I presented you was clear. So let's start with the first question. What are the Velcros of the Mobiderm AutoFit for? Are they intended for adjusting the pressure, to facilitate donning and doffing, to adjust to the patient size, or to follow limb volume variation? So multiple answers can be correct. So please vote.
So the majority answered adjust the patient size, and then we have follow limb volume variation, and equally facilitate donning and doffing and adjust the pressure.
Okay, so adjusting the pressure is not the intended use of the Velcros because the product has not been designed this way. So if you tighten more the Velcros, we don't know how much pressure you're going to apply on the limb. So really the Velcros are intended, first of all, to adjust these standard garments to the specific sizes, the specific circumferences of the patients. And in addition, it will facilitate donning, doffing, and allow the patient self-management and follow the limb volume variation. So it's really not intended for adjusting the pressure. So which Mobiderm garment is recommended for severe lymphedema? Is it the Mobiderm standard, the AutoFit, or the made to measure?
Few more seconds. So the most chosen answer is Mobiderm made measure.
Yeah, that's completely right. So severe lymphedema usually are pretty large in sizes, so they may not fit into a Mobiderm AutoFit. So that's why we recommend made to measure. But the AutoFit can be an alternative depending on the size of the limb. And last question for this first part is Mobiderm AutoFit arm sleeve ambidexter. So meaning, can we use the Mobiderm AutoFit arm sleeve for left and right side with the same product? What's the most popular answer in? Him? Him, can you hear me? Slavomir, can you hear me?
Yes, of course I can hear you. So I think we should continue because maybe there is a kind of.
Elle a un problème. Okay.
Yeah.
So sorry for this. We're gonna move on. So the Mobiderm AutoFit arm sleeve is not ambidexter because you have the mitten attached. You cannot use the same product for right and left side. So it's the Mobiderm standard mitten and also the Mobiderm AutoFit lower limb garment can be used ambidexter and can be used for left and right side. So I will let now Slavomir present you the clinical evidences we have on the Mobiderm garments.
Yeah, thank you, Matteo, for your very clear, accurate presentation of Tuan proposition and solution dedicated for stabilization phase. And, excuse me. And of course, it is obvious that for clinicians, for practitioners especially, this is particularly important whether the product recommended for patient and use in the therapy have clinical documented therapeutical efficacy. So I will introduce, present, and discuss briefly 6 interesting studies devoted to the use of Mobiderm. Let's see how to change. Oh yeah. There you can see a brief summary, a table with basic information about researches that I will present and discuss briefly today. So except the information about the authors, the country in which has been conducted, you can see the information concerning the level of evidence for each study. The level of evidence has been assessed according to Journal of Bone and Joint Surgery level of evidence for primary research questions. So based on this assessment, 5 levels of evidence has been described. And the first study presented today is a Maryland study. The interest of the out of adjustable nighttime compression sleeve Mobiderm AutoFit in maintenance phase of upper limb lymphedema. So the objective of the Maryland study was to determine the interest of auto-adjustable Mobiderm AutoFit compressive arm sleeve used at night in controlling edema rebound effect in breast cancer-related lymphedema patient directly after a successful intensive phase of DLT and decongestive lymphedema therapy. In fact, this is a subgroup analysis conducted on 40 patients after completion of intensive DLT. Patients were randomized into groups: night user group fitted with AutoFit device and no night user with no night compression. For subgroup analysis, patients have defined as high responders if their lymphedema volume reduction during DLT was higher than 35%, or as a low responder if there was below 35%. What were the result of the study? In high responders group included 16 patients. The mean lymphedema volume variation between day 0, so directly after assessed directly after DLT, and day 30 was more than 28 milliliters in the night user group versus 181 milliliters in no night user group. So significant difference. When adjusted to the loss of volume during DLT, 89% of DLT benefit is maintained in high responders night user versus 54 in high responders no night users. In addition, a very typical symptoms of rebound effect, like a heaviness, like a pain or limb use limitation and volume increase, of course, have been visible in the no night user group. The next very interesting clinical study conducted on a group of 145 patients in Italy and called Mobiderm is a clinical use of nighttime Mobiderm garment as a treatment modality for breast cancer-related lymphedema, a retrospective longitudinal cohort study. The aim was to check the results of made-to-measure Mobiderm arm sleeve, made to measure this time, the Mobiderm arm sleeve in chronic patients. There were 99 chronic patients, and in newly diagnosed lymphedema patient, they had 46 cases. The average patient age in whole group was 66 years. During the study, 99 so-called chronic patients have been observed and after introducing made-to-measure Mobiderm garment at the day 0, also newly diagnosed patients have been observed for the next 6 months. In chronic patient group, before made-to-measure Mobiderm arm sleeve introduction, the rebound effect was visible in 74 patients, and it was related to more than 7% of volume increasing. 6 months after Mobiderm introduction, the stabilization effect has been observed in whole chronic patient group. Furthermore, the average lymphedema volume in the group decreased by more than 1%. In the newly diagnosed group, significant reduction has been registered after Mobiderm arm sleeve introduction. It was, in fact, in average, more than 7% of volume reduction. In addition, high acceptability of the device by patient was confirmed by overall good adherence to night garment. Let's have a look at the next study, the case study this time. Mobiderm AutoFit, an adjustable sleeve that enables patient to self-manage lymphedema. 3 patients with severe stage of upper limb lymphedema have been observed and described. The age of patient was 85, 48, and 66 years old, respectively, and treatment duration was respectively 11, 14, and 11 days. For each patient, Mobiderm AutoFit was used for whole night. The results of observation we can conclude in 3 main conclusions, which are nighttime compression is beneficial in lymphedema management with reports of reduced swelling, improved pain management, and better sleep. Mobiderm AutoFit enhance nighttime compression therapy and allows more self-care. Mobiderm AutoFit provides practitioners with a greater range of treatment options to provide a tailored treatment package. The next research that I would like to present to you is the POLIT study, which is prospective multicenter observational study of lymphedema therapy. This study concerns the use of a Mobiderm bandage. The objective of the study was to assess lymphedema volume variation between baseline at the end of intensive phase and 6 months later, I mean after the intensive phase. 306 patients, mainly women. It was 89, almost 90% of the patient were women, with 184 upper and 122 lower limb lymphedema were included. And Mobiderm bandage has been used during intensive phase of the therapy as an element, as a component of multi-component bandaging system. At the end of the intensive phase, median access lymphedema volume reduction was 32%, followed by a 16% median increase over a 6-month maintenance phase period. I would like to quote 3 main conclusions from the research. The first was intensive phase decreased lymphedema volume and heaviness. Use of Mobiderm bandage in reduction phase seems to have better outcome than padding after 5 days of therapy. And benefit of the congestive lymphedema therapy is partially lost after the first 6 months of maintenance phase. So it has been confirmed by the 16.5% of volume increase in average. The next study presented is lymphedema management at night, views from patients across 5 countries. The aim of this study was to gain a comprehensive insight into the use of nighttime compression in the management of lymphedema in patients who had been suffering from chronic lymphedema for over than 12 months. Data were collected and analyzed from 94 patients this time across 5 countries like UK, USA, Sweden, Australia, Germany. And positive outcomes from the use of nighttime compression were reported with all patients identifying benefits of using nighttime compression. The other conclusions are nighttime compression has been positive effect for up to 24 hours. Main reason for not wearing nighttime compression are fatigue, heat, or stable edema. More than 80% of patients experienced a reduction or maintenance of the volume wearing at night time compression. 2/3 of patients started using nighttime compression because of health professional recommendation. And nighttime compression reduced swelling, improved pain management, and allow better sleep, which improve definitely the quality of life of each of Mobiderm users. In the summary of those 5 studies I presented, I would highlight Mobiderm AutoFit limits rebound effect of lymphedema when used right after DLT, especially in patients who are strongly responsive to DLT. Mobiderm AutoFit allows stabilization of lymphedema volume when used later during maintenance phase. Mobiderm AutoFit increases patient independence by keeping high level of compliance. In newly diagnosed patient, Mobiderm is associated to a significant volume reduction of lymphedema. We could observe this effect even in stabilization phase in newly diagnosed patient. They get a significant reduction. Nighttime compression is beneficial in lymphedema management with report of reduced swelling, improved pain management, and better sleep. And Mobiderm AutoFit enhances nighttime compression therapy and allows more self-care. Mobiderm AutoFit provides practitioners with a greater range of treatment options to provide a tailored treatment package. And at the end of my part of this presentation, I would like to present very interesting, in my opinion, a study from Poland, from Department of Rehabilitation in Oncology Center Institute in Warsaw. It is the use of single chamber IPC with Mobiderm in upper limb lymphedema treatment. So probably the subject looks strange because most of you know the recommendation regarding IPC usage for lymphedema treatment. You may remember the general recommendation is to use multi-chamber IPC device. It means a device which has 8 or more chambers if used for lymphedema treatment. The more chambers the cuff, the sleeve of IPC has, the more effective it will be. Sometimes, however, we still can see somewhere in the hospitals, in the clinics, let's say older, old-fashioned IPC device like single chamber, for example. So the aim of the study was to observe what will be the effectiveness of this old-fashioned single chamber IPC device when used with Mobiderm. And to randomize patient groups they observed, each group consisted of 30 patients, 56 years old in average. All the patients with upper limb lymphedema. Group A study group was the group with Mobiderm applied together with single chamber IPC device. The pressure applied was less than 40 millimeters of mercury, and the time of the treatment was 30 minutes. Group B, represented by orange pillars. Group B, control group, includes also 30 patients, this time 57 years old in average, so almost the same year, the same value in the group A, in which single chamber IPC has been applied without Mobiderm, just a single alone IPC, single chamber IPC. This time the pressure for this group was higher, was between 40 to 80 millimeters of mercury, and time of the treatment was also longer. It means it was 40 minutes. The main conclusions of this study are the use of Mobiderm in single chamber IPC improves the effectiveness of the therapy, even if the pressure and the duration of the therapy have been reduced comparing to the group B. For the study group, the reduction in the average circumference calculated for whole limbs was 5%. It was shown here with those yellow pillars. While in the control group, the reduction was 0. So when they use the single chamber IPC alone, they did not observe any effectiveness of such a therapy in inverted commas. So this is why the general recommendation is to use multi-chamber IPC. But even if they observe single chamber IPC, but with Mobiderm, they could observe effectiveness described by the 5% of mean average circumference reduction. Okay, so at the end of my part, I would like to ask you some questions.
Slavomir,
yeah.
Slavomir, do you want me to run the quiz as you have to go?
It would be absolutely perfectly because I need to leave, you know. Yeah.
So yeah, we apologize, but Slavomir has an important last-minute meeting with the Polish authorities. So I'm gonna continue the presentation. Thank you very much, Slavomir.
Thank you very much. Thank you. Have a good evening.
Have a good evening, Slavomir.
Bye.
So the question related to the clinical studies presented by Slavomir. So first question, which patient's patient profile gets the better result wearing Mobiderm AutoFit? Is it all chronic patients, patients who were strongly responsive to DLT, patients who are not strongly responsive to DLT, or newly diagnosed patients? So please vote.
You can have many answers for this question?
Yes.
Yes. So the majority answered patients who were strongly responsive to DLT, newly diagnosed patients, and all chronic patients.
Yeah, so based on the clinical study, it's mostly patients who are strongly responsive to DLT and the newly diagnosed patients. So second question, which results brings Mobiderm Autofit when it's used not right after the DLT, but later on during the maintenance phase? Does it stabilize or does it reduce the lymphedema volume? So if it's not used right after DLT, but later on in maintenance phase.
So for this question, most responded stabilization of LO volume.
Yeah, so that's correct. So if not used right after DLT, but later on, it will stabilize the volume of the lymphedema. If the Mobiderm Autofit is used right after the DLT, right at the beginning of the maintenance phase, then you can expect a reduction of the lymphedema volume based on the studies. After how long the benefits of the DLT are partially lost? So that's the POLIT study. Thus, the POLIT study demonstrated that the benefits of DLT is partially lost after the first months of the maintenance phase, the first 3 months, the first 6 months, or the first 12 months.
So the participants mostly responded after the first 6 months of the maintenance phase.
Yeah, that's correct. It's what has been demonstrated by the POLIT study, that the benefits of the DLT are partially lost after the first 6 months of the maintenance phase, meaning that then the patients start having a regrow, a gain in volume of their lymphedema. Okay, very good. So then now we're gonna discuss about patient self-management. So we had many questions from physicians, feeders and patients during the lockdown in the different countries about how to self-manage the lymphedema for the patients, because in most of the country they had no access to the doctors. They were not able to go to the hospital to get their treatments, and even to go to the feeder, because made-to-measure garments require to have skin contact between the orthopedist or the feeder and the patient. So that was a difficult situation to manage, difficult time for the lymphedema patients. So the self-management principle, I would say, I'm gonna share with you now, are applicable all over the year. So it was it might be more difficult to manage during the lockdown, but that's what every patient should do during the maintenance phase at home to manage their lymphedema. So there is a first aspect around skincare and hygiene, one about clothing and compression garments. The exercises, sport activities are very important as well in lymphedema treatments. There is some dietetics principle to follow as well. Self-massage to compensate the fact they were not able to go to the physio. Self-monitoring to monitor the skin aspect and the lymphedema volume, and networking, because the lymphedema patients are usually very educated about their pathology, because it's a pretty rare disease. So they tend to exchange a lot with other patients to have a better knowledge of their pathology and get experience from others. So if we develop those different aspects, first, the skincare and hygiene. So it's very important for those patients to take care of their skin, because the skin damages and the lymph accumulation in the tissue will affect the dermal aspect and the risk to get infections. So it's really important to follow skincare and hygiene to prevent complication and limit having a dry and malnourished skin, and avoid any skin damage. So it's about using body care daily, but it's also about taking care of avoiding being cut, tear cuticles, beware of insect bites, and avoid all type of injuries, sunburn, all those type of things. So it's really part of the patient education provided by doctors and also by fitters, to explain them what they need to be aware of and to take care of. So the skin, keeping clean and hydrated skin is really important in this pathology. The second aspect is the clothing. So clothing like normal clothes, and also the compression garments. So the compression garment will ensure having an effective control of their lymphedema during daytime and during nighttime. And it's really important for any clothing to avoid any striction, because if they create some striction, they will limit the lymph circulation. So it's recommended usually for the patient to wear comfortable clothing, comfortable shoes, avoid wearing jerrys, because those things may create strictions at some area of the body and limit the lymph circulation. And regarding the compression garments, it's important to check the compression garments and have a good care of the compression garments, because if the compression garment has been used for too long, it will become slack and it will become ineffective. So it's very, very important to replace the compression garment on a regular basis to keep the efficiency of it. So regarding exercises, so it's recognized now that the sports and exercises in general are beneficial for lymphedema patients. The body movement is really important in promoting the blood circulation and the lymph circulation. So it's also a way to maintain a healthy weight, because obesity is a risk factor for lymphedema patients. And there is also all other type of benefits practicing sports, because it will improve self-image, it will reduce some of the symptoms, and it will provide a relaxing effect and a psychological well-being for the patient. So even if the patient is not doesn't like, to practice sports, there is some alternative and some simple exercise that can be practiced at home to help to promote the lymph circulation. So there is some practice very well adapted for lymphedema patient, like Nordic walking. All the water activities are very interesting as well, Pilates, yoga, Qigong. So all the smooth sports are very well recommended for those patients. And it's also a way for them to have networking with other lymphedema patients. It's important for them to wear their compression garment during the practice, because it has been demonstrating that wearing compression garments during sports will limit the occurrence of pain and edema. And you can, if the patient doesn't want to practice sports as such, he can make some daily exercises. So you have multiple videos online on YouTube with physio showing some simple exercises adapted to upper or lower limb lymphedema, step by step, that can be done at home very easily with almost no material. So that's those type of video where are very interesting in case of lockdown, like we had. So the patient can get information and practice in autonomy at home. Regarding dietetics, so it's mostly about preventing obesity. So it's important to maintain a healthy weight, because obesity is a major risk factor in the development of lymphedema. So that's about eating a balanced diet, moisturizing the body, drinking water. So it's important to drink around 2 liters per day for those patients, and sport and exercises are part also of the of maintaining these healthy weights. Regarding self-massage, I would say this one is the more tricky one to make for a patient in case of lockdown. But it's a very important one in normal situation, I would say. Most of the patients, they go to the physio 1 or 2 times a week, depending of their lymphology evolution. And so during a pretty long period, the patients were not able to go to the physio. So many videos are available again on YouTube with physio explaining to patients how to perform daily self-massage adapted to different location of lymphedema. So it's really important to keep stimulating the lymph system even during a situation like a lockdown. And it will really help cleaning and relieving the subcutaneous tissue and the lymph nodes. So it's really important to keep doing those type of massage if the patient is unable to go to the physio. Self-monitoring is also something that a patient can easily do at home. Doing the self-monitoring of their lymphedema, it's about, I would say, following different things. It's about following the volume evolution. So you can use simple tables like the one shown on the screen, where you can take circumferences at different points on the lymph and check every week, like for example, if there is an evolution. If the patient sees an evolution, that means he can self-adapt the treatment in a way, doing maybe more exercises, maybe wearing more often nighttime garments or the daytime garments. so he can adjust a bit the treatment himself. But the monitoring also of the skin aspects is very important. So it can they can take some notes about the aspect of the skin, number of skincare they are doing per week, number of self-massage they are doing per week, and exercises, and also take note of the follow-up of any complications. So some of the complications, the patients being such educated about their pathology, they know how to manage. In some other cases, they cannot manage by themselves and they need to see a doctor. But all those things are very important to follow about the pathology. So it's just about taking note, like once a week in a journal to check all this and adjust again the treatment based on the monitoring. Networking is very important for those patients as well, and it was, I think, even more important for everybody, I would say, and even for the lymphedema patient during the lockdown. So they can exchange on different social media, so on Facebook, on LinkedIn, on Instagram, all those social media. There is a lot of groups, either initiated by doctors or by patients, patient association, with a lot of information about the pathology, with a lot of experience sharing, best practice sharing. So it's also very interesting for them to subscribe and follow such a social media group to improve constantly their knowledge about the pathology. So that's it for the self-management and for the presentation. So I'm gonna try now to answer your question. So all the very clinical oriented question, as I'm not a doctor, so we may have to come back to you later on if I'm not able to answer. Slavomir will pick your question later on today, and we will send you an email with the answers. But Rim, if you have some not too clinical oriented question, I can answer those ones.
Not for now, but everyone, please, if you have any question, you have the chat box where you can write all your questions, and I will read them to Mathilde so she can answer you.
Don't be shy. We have 15 minutes left, so we can answer some of your question if you like. And even if it's a very it's more clinical oriented question, feel free to ask the question in the chat box, so we can then forward your question to Slavomir to provide you an answer.
So I have a first question. How long does the Velcro last on the garments?
So all our Mobiderm devices are guaranteed for an effectiveness of 6 months. So so the Velcros and the efficiency of the Mobiderm foam is guaranteed for 6 months of usage, of normal usage, and then we recommend to replace the products, mostly to ensure a good compression, because the compression may lower during the time after the 6 months, but the Velcro usually they tend to last longer than 6 months based on customers' feedback. But it's all about how they take care of the garment. So they need to take a proper care, wash it on a regular basis, make sure that the Velcros get not in contact with other garments in the washing machine. So that's why we recommend the use of a laundry net to avoid those type of things. And the Velcros cannot be replaced. So if the Velcros are damaged, the entire garment needs to be replaced.
Thank you, Mathilde. Second question for you. Can the Velcro tabs, as in the auto-fit garment, be used in the made-to-measure garments for complicated, unconventional shaped limbs?
No, we don't have Velcros available on the made-to-measure. The idea of the Velcro being to ensure a perfect fit of a standard garment to a specific patient measure. We don't have the Velcro on the Mobiderm made to measure, because the Mobiderm made to measure is already done based on the patient measure, so and gonna ensure perfect fit. But you can have a Velcro opening on the Mobiderm made to measure garments to facilitate donning and doffing. So you can define the length of the Velcros you want, Velcro opening, and you can have this option on the garment. But it's an opening, it's not an adjustment.
And do you wrap the whole limb for IPC or some sections?
Can you repeat?
Do you wrap the whole limb for IPC or some sections?
Yeah, so it's the recommendation is to wrap the entire limb with the Mobiderm when used with IPC. So you can wrap it with a Mobiderm big blocks bandage, or you can even do it, with a garment below the IPC. So you could have, for example, a Mobiderm AutoFit sock, or a below knee or a thigh high, and use the IPC on top of it. So it can be, in some cases, more cost efficient, because the patient will not have to pay for Mobiderm bandage and a garment. He can buy a garment and use it together with the IPC. Do you have other question, Rim?
Yes, thank you, Mathilde. So some clients report the AutoFit tabs are a bit scratchy at night in bed. Would some kind of lycra cover sleeve to wear over the garments help with it?
Yeah, so I suppose the question is about lower limb, because it's for lower limb AutoFit that we already had this feedback. So because the two legs between in contact to each other during the night and the body movement during the night, it can happen that the Velcros of the limb with Mobiderm AutoFit can scratch and hurt the skin on the healthy leg. So that's something we are aware of, and we are working on developing a new version of Velcros that's gonna be softer, and that will avoid this issue. For now, it's not yet available, it's in development.
Thank you very much for this information. I hope it's clear for everyone.
Any other question?
No, please, we still have a few minutes, so I'm sure Mathilde will be glad to answer your question. So, do you recommend the use of a non-compressive liner under the auto garments to keep them cleaner?
Not to keep them cleaner. So we recommend the use of a liner below the Mobiderm garments, the AutoFit or the others, only in case of skin reaction to the Mobiderm. Otherwise, there is no reason for using a liner, because even for to maintain the compression of the outer layer of the Mobiderm garment, it's recommended, as for knitted garment, compressive garment, to wash it after every usage, so every day. So I would not recommend a liner for the purpose of having a longer lasting garment and avoid washing it too often.
All right. Is Mobiderm able to be used for chronic pain like fibromyalgia?
I don't think we have clinical proof regarding this. Maybe you can take notes, Rim, about this question, and we can ask Slavomir about his experience around it.
Yes, of course.
What is sure is that and it's something we didn't really mention, the Mobiderm, the usage of the Mobiderm as a garment or as a bandages, whatever, is really softening the skin. Many patients report that they have a softer and more elastic skin after the usage of Mobiderm. But that is something on which we have no clinical proof today. So we are still running, we have, I think, 6 or 7 new clinical studies initiated on Mobiderm to continue demonstrating other benefits of Mobiderm, and skin aspect improvements is one of them for sure, that we are trying to prove with a clinical study. But for this very specific question and case, as I'm not doctor, I cannot answer to that one.
Okay, thank you. And just to follow up on the liner question, so can we wash the garments daily, and what about drying them?
Yeah, so the Mobiderm in the different version, it cannot go to the dryer, so it has to dry at room temperature and not close to a heat source of heat like sun or those type of things. So if you wash it every day, if you wash it after the night, like in the morning, usually it's dry by the next evening. So but you know, it depends on the temperature in the house and many things. So in the ideal world, it's better to have 2 garments, so then you can use it make a switch from one to the other during the washing. But most of the time, the garment is going to dry during the day at room temperature.
I hope it's clear for you. So in case of AutoFit, Velcro adjustment is not about pressure. It is just a size adjustment, but isn't it affecting the pressure if it's pulled strongly?
Yes, it will affect the pressure. The way the AutoFit has been designed with the Velcro is to adjust to the patient limb volume. So when you adjust the Velcro based on the tables I showed you, based on the precise circumferences of the patient, you're gonna get around 15 millimeter mercury of pressure, which is the intended pressure we wanted to have on Mobiderm for night to ensure a good compliance and not disturbing patient sleep. If you tighten more the Velcro, automatically you're going to apply more pressure in the garments. But we don't know how much pressure you're going to apply then. So if you do it, we cannot, we have no idea about the pressure you're going to get below the garment. So it might be not well tolerated by the patient during the night. And if you apply too much pressure on the cubes, on the foam cubes, it may become less efficient as well than with the proper pressure. So yes, but I do not recommend it because then you don't know how much you get.
Thank you very much, Mathilde. So I think we are done with the questions.
Okay. So thank you very much, everyone, for your participation. I hope it was interesting for you. And I wish you a pleasant evening. Thank you.
Thank you very much for attending the webinar. Thank you, Mathilde, for this great presentation, and for Slavomir as well. And we hope to see you soon in further webinars. Have a good evening. Bye.
Bye.